So I am a physical therapist. I'm the director of physical therapy at a skilled nursing facility. I did my undergraduate work. I went to a couple of community colleges, and then I went to Sacramento State University, did finish up my bachelor's there in kinesiology, and then applied to a graduate program and received my master's in physical therapy at Sacramento State as well. You have to at least have, at this point, in order to be a physical therapist, you need a doctorate of physical therapy. I don't believe any programs out there offer a master's program anymore. It used to be a bachelor's and then a master's and then a couple of years later a doctorate. So you can go from an undergraduate degree straight to a doctorate program, a DPT, but you can still practice if someone has a bachelor's of physical therapy. That person can still practice as a physical therapist as long as they keep up their license in whatever state they're working in. You actually going through school, you have to do clinical internships. So before you finish your graduate program or your doctorate program, you have to work as a student in the clinic for, let's say, 8 weeks or 12 weeks at a time, and you have several of those clinic experiences. After that, you apply for a job, and basically the only experience you've had is the experience from your school, and you get on-site teaching from whichever facility you're working with. And then you also have to maintain your credentials, your license, and you have to do a certain amount of hours or units per every 2 years. So it's an ongoing learning experience for a physical therapist. For me, being a director, my hours are pretty much all the time. So I'm here at the facility Monday through Friday, let's say 8 to 4, 8 to 5. But I'm actually working from home sometimes on weekends. I take phone calls all the time, messages. So, but if you're a physical therapist, yeah, a staff physical therapist, your job would be basically Monday through Friday, or if you have a day during the week off, you would work a weekend. So it really varies depending on your facility. If you're an outpatient, it's usually Monday through Friday. If you're at the hospital, you'll have to work some weekends. If you're at a SNF, you'll have to work some weekends as well. So it really depends on what setting you're working at. Daily routine. So as a physical therapist, you'll have to basically see a certain amount of patients per day. Basically, you go to work, see your schedule, and then see the patients that you have on your schedule. And usually you have about seven hours of treatment time, and that's approximately your 8-hour day, including notes that you have to do. For me, as a director, I have to do a lot of meetings. I have to go visit hospitals, do some marketing, and do a lot of scheduling. So I do treatment, but not as much as a therapist. For a physical therapist, the salary varies. So if you're looking for a position in outpatient, the starting salary is approximately $60,000 a year. Some facilities, depending on the area, may be able to offer you a little bit more or a little bit less. It depends on which state you're working in and how much of a need that facility is in. Hospitals, they'll start you a little bit higher. You'll probably be able to negotiate maybe about $70,000 a year to start out, and then skilled nursing facilities about 80, and then from there you just have room to grow. it's a pretty flexible career. If you're in a facility like ours, a skilled nursing facility, as long as you're able to see your patients, that's what counts with us. If you have an appointment in the middle of the day and you just have to come a little bit earlier, if you come in at say 7 o'clock in the morning, 8 o'clock in the morning, and then have to leave for 2 hours in the middle, you just clock out and clock back in when you come in, and then you just stay later. So the facility, the nice thing about this is the facility is open 24/7. So whenever the patients are up here, you can see them. You can go to their room. We have a gym in the facility. So you come to work, go to the patient's room, bring them up to the gym area, and then do the treatment. You have to be very approachable, you have to be able to put yourself in another person's shoes. We get people that come from the hospital with a stroke, with a knee replacement, a hip replacement, broken ribs, CHF. They've had a heart attack. So you get a wide variety of patients. So you have to make sure that you are aware of how to treat each patient, and you have to make sure that you're easy to talk to and that you're always friendly to them. Employment is very, very high right now. So basically any graduate from any school, you'll have a really high probability of getting a job in any city that you're in. It's being a therapist is in high demand. So you just go to school, finish it, take your licensure exam, pass it. As soon as you get your license, you can apply, and within a couple of weeks you would have a job. With advancement, the more years you have under your belt, the more you practice, you'll be able to move up. If you're more interested in management, then you just have to look to facilities that are willing to train you. It's a different aspect of the physical therapy side. It's just, if you want to go more into the business side, you just have to find someone that can mentor you and that is willing to work with you. But there's a high probability of advancement in this area. So, like I said, if you want to progress in your career, you have to find a mentor. That would be great. On the job training is always done depending on the facility that you're at. They'll teach you for a certain amount of weeks, months. But being a physical therapist, you have to always keep up with a certain amount of units or courses that you have to take throughout your career. Every 2 years you have to renew your licensure, and as long as you keep up your license, you'll be able to maintain this career. There's several. So showing up on time, how you work with your patients, how well versed you are with different diagnoses, how well you treat, how well you communicate with your coworkers, how well you communicate with other staff members that are not only your coworkers. Like a hospital, you have to coordinate with nurses, you have to coordinate with MDs, orthopedic surgeons. You get to see a lot of patients leave happy. You can see a whole turnaround. They come in here not being able to walk, not having a fracture, barely being able to move, in a lot of pain. They don't know if they'll be able to go back to their previous activities. Family members are not sure if they can go back home. So seeing them rehab and go back to their previous activity is and return to their family, and it's a good experience. You get to see a lot of smiles. Sometimes the patients that can get better, they don't want to work, or they have the mentality that they're not going to get better. So I would say the most frustrating part of this job is seeing the potential in the patients and them not seeing it themselves, and you just trying to encourage their participation. It's a lot of psychological assistance that you're giving them. You have to really be able to communicate, like I said earlier, communicate with them and really emphasize the fact that they can get better, and because you work with patients that are like them, but they don't see it themselves because they've never been in this position before. I have to say it was a time like this, like I just explained. This patient was very motivated. I had a patient when I was a staff therapist. The family was very involved with them. I wanted them to come back home. They weren't sure if he was going to be able to perform at the level that he was before. Um, I was able to work with them, and he was able to return back to home and basically his same life that he had before. And then they made me a little mug with my name on it, and it's very rewarding when someone takes into account all the hard work that you're doing. In this facility, we use parallel bars for people that are not able to use walkers yet. So we get the patients that are fairly low level. We use walkers, crutches, canes, quad canes, omnicycles. It's kind of like a bike, but a recumbent bike. We don't use treadmills here. If we do any walking, we walk in the hallways. We do obstacle training around here, so we use a lot of anything that's going to look like an obstacle for the patient to go around them, around or over. Steps, we use stairs as well. We use a mat table. That's a lot of equipment. A lot of orthopedic diagnoses. So shoulder replacements, um, shoulder fractures, hip fractures, knee replacements, ankle fractures, mainly orthos, but a big variety. Like I said, cerebrovascular disease, strokes, CHF, generalized weakness. Someone just is deteriorating from age. Someone falls at home. They end up coming here just to regain a little bit of strength and go back home.